We are deeply alarmed by the reports from Al Nasser medical complex. This medical complex has been barely functional, and there is now reported damage to the orthopedic unit, and that obviously reduces the ability to provide the urgent medical care. So more degradation to the hospital means more lives being lost. Now, there are still critically injured and sick patients that are inside the hospital. There is an urgent need to deliver fuel and to ensure the continuation of the provision of life-saving services. We also need to do assessment to try to identify most critical patients and see how we can have their safe referral. We are at the UN coordinating to asking and looking for the urgently access to the hospital. We have been saying all this time, you have heard me and then others from WHO, that patients, health workers, and civilians who are seeking refuge in hospitals, they deserve safety and not a peril in those places of healing.
Our staff, before they left and fled the Nasser hospital, were reporting a very chaotic situation. Thankfully, if I can say that, all but one of our staff have been accounted for. One of our staff members hasn't been accounted for, and we remain deeply concerned about their well-being. We don't know what has happened to them since then. They were told and asked to head east, but the situation in the hospital and the surrounding area is incredibly chaotic, and so we don't know precisely what has happened to all of our staff. I think contingency is a very optimistic word in this situation. Nowhere in Gaza is safe. We're also extremely worried about what's going to happen in Rafah, or what could happen in Rafah in the coming days. What we're being able to do is literally work on a day-to-day basis. An incredibly dangerous place for our teams, both our international teams and our Gazan staff, who have been working throughout this crisis. The tragedy of this situation is there are not many options, and the options are fading fast. Nowhere in Gaza is safe.